Well, in China's Hubei province, the epicenter of the coronavirus epidemic, authorities have confirmed there were more than 100 deaths from coronavirus on Sunday. That brings the global death toll to 1,770. More than 1,900 new cases in the region have also been confirmed, a drop for the fourth consecutive day. Our chief anchor, Kieran Gilbert, is speaking to China's ambassador to Australia about the coronavirus outbreak. We'll take you there live now.
Ambassador Cheng, thank you very much for your time. First of all, on the drop in new cases of the coronavirus, there's been a consecutive, I think, 4 days now, a drop in the new numbers of coronavirus. Is that encouraging? How close is China to a breakthrough in dealing with this epidemic?
Well, thank you, Kieran. It's a good opportunity, to talk with you.
Thank you.
I think, since the outbreak of the novel coronavirus, under strong and firm leadership of President Xi, the Chinese government has made unprecedented efforts to fight against the epidemic, which includes the establishment of a nationwide mechanism, the full mobilization of the national resources, and adoption of the most complete and vigorous measures to prevent and control. And the Chinese people, as united as one to confront the challenge presented by the virus. And thousands of medical workers work at front, around the clock, to treat the patients and save their lives, while we have done our utmost to contain the further spread of the virus. And thanks to those arduous and tireless efforts, we are making good progress. Generally speaking, as I see it, the epidemic is under control. For example, in the past 12 consecutive days, the number of the confirmed cases have been dropped, and the accumulated drop rate is over 50%.
So you think the epidemic,
outside Hubei,
you think it's in control now?
It's out of Hubei, and also at the same time, the cure rate, we see a rapid increase in the cure rate. Now, with more than 10,000 people have been recovered and discharged from the hospital.
But you believe the epidemic is in control? Is that what you said?
So those figures has demonstrate that the disease is controllable, epidemic and disease curable. So we have every confidence, capacities, to win this battle against the epidemic.
You've expressed regret and dissatisfaction at Australia's travel bans because they exceed the WHO recommendations, but at the same time China is taking extra steps, as you've mentioned, internally beyond World Health Organization recommendations as well. In fact, entire provinces have been quarantined, more than 100 million people quarantined. So if China's taking steps beyond the WHO, can you understand why Australia too wants to protect its population?
Well, first of all, I think, we are deeply disappointed over the restrictive measures that have been taken, because as I see it, they are out of proportion. Well, the case in China, the situation in China is totally different from here. The focus, of course, is in Wuhan and Hubei. That's the epicenter. So we need to take extra measures, to stop the spread of the disease. And while here, the situation is totally different. And as you said, is inconsistent with the professional, recommendations of WHO. They disapprove of any measures that would unnecessarily interfere with international travel or trade. So that's that's the first point. I mean, I want to emphasize. The second thing, I think, I mean, it's all natural and reasonable for countries to take enhanced measures or screening measures. But, I mean, at the same time, you have to be cool-headed and not to be panicked. I think throughout the world, except outside China, I mean, the confirmed cases of the virus is less than 1% of the total number.
But given the restrictions in China, you've got such strong restrictions in China, isn't it true that the prospect that many students or tourists wouldn't be able to travel to Australia anyway because of the restrictions internally?
That's a totally different thing. I mean, we have of course we have strengthened, I mean, the inspections and screening at the airport, but we have no restrictions for people, I mean, for students to travel abroad outside Wuhan or outside Hubei. So that's the difference. I mean, also, I just want to say, I mean, Australia is only one of few countries that has taken such a, I mean, sweeping and stringent restrictive measures on travel. I mean, you have to be, I mean, be rational and be,
but you've met with
responding to the actual situation, which should be commensurate with the actual situation on the ground.
You've met with Australian government officials and ministers, I know, over recent days about the travel ban. Do you accept, though, I mean, obviously it's having a very big economic impact here as well, isn't it? So would you...
That's the third point I just want to touch.
So would you accept that the government would want to get rid of the travel ban as soon as they can?
Well, we have expressed our strong wish and hope that you will, I mean, the Australian government, in their next review, will take into account all the situations and take a balanced approach and to positively consider removing those harsh restrictions, at least to relax the restrictions.
Reports out of China suggested that the 34-year-old doctor who raised concerns in Wuhan in late December was detained and forced to disavow his comments. As a result, do you think China, in terms of the response in Wuhan to begin with and cracking down on the individual who raised the situation in the first place and his concerns, do you think China was too slow to react to the emergence of this virus?
Well, first, I just want to clarify, Dr. Yu was not detained, to the best of my knowledge. I think Dr. Lee is a good doctor with dedication and compassion. And he has done, I mean, for what he should do. I mean, his contributions is duly acknowledged. I mean, he's just one of those thousands of medical workers who work at the forefront to fight against the virus. And I think the best way, I mean, in memory of him, is to focus and concentrate and continue, I mean, the fight against the virus with more vigorous and more forceful measures.
But was China too slow? China too slow to respond?
As for, I mean, the response to the outbreak, I think we have done very quickly. I mean, you know, I mean, this virus is something new with unusual nature. Sometimes it takes time, I mean, to get knowledge of it and to know about the true nature of it. You need time and you need, I mean, the process of identifying and assessment. And once we identify the virus, we promptly acted and informed the WHO. And at the same time, we have started an all-out campaign across the country to stop the spread and to contain the virus.
Officials in Wuhan were blamed by Beijing, but it was revealed over the weekend out of China that the President Xi, knew about the virus 2 weeks before he publicly spoke about it. Should some of the blame be directed to more senior levels within the Communist Party?
I think, I mean, President Xi himself has shown his strong leadership in this, fight against the virus. He has been personally involved and giving his instructions and orders, and also outlined strategies, and also he's personally overseeing the situation and directing and guiding all the efforts that has been made throughout, this outbreak. And it is because of the strong leadership of the president and of the Chinese government, we have so far making progress. Of course, more efforts are needed, but we're confident we will come out of the fight, successfully.
The fact that he was aware and the Politburo was aware 2 weeks before it was made public, does that create a sense of concern?
As I said, from the very start, when we identified the virus, when we found this new virus, swift and timely action has been taken. And there have been 3 meetings by the highest leading body, that is the Standing Committee of the Chinese Communist Party Central Committee. And they are in the present to make inspection tour in Beijing, and also to give his instructions, to give his guidance to the nationwide campaign against the spread of the